Hi, this is Dr. Greg Oliver with Fat Doctor TV. In my office today, actually in one of the exam rooms here, and I'm seeing patients today, have a little break, so I wanted to kind of talk to you about what I do and what I say to patients when we talk about weight loss. If you carry extra weight or you have obesity in your own life or in your family and you've been to the doctor, then you've had experiences there. Unfortunately, in a lot of situations, and I'm guilty of this too, have been in the past, not anymore, but would tell the patient you need to lose weight, here's a diet sheet, or my nurse will get you a diet sheet and send them on their way. And that doesn't really work. But we all know, physicians know, patients know that carrying around that extra weight and the obesity epidemic is really giving rise to serious health problems in our society. We know that obesity leads to early atherosclerosis, which is hardening of the arteries, causing heart attack, stroke, premature death. We also know that obesity leads to diabetes, and then there's an epidemic of diabetes. When I first started in practice, I would diagnose a new onset type 2 diabetic about once or twice a month, and now it's about 12 times per week. So it's critical that we work on the weight issue here. So when I'm in the exam room with a patient and we handle whatever problem they were here for that day, if they do have extra weight or that's an issue, I ask them, would you like to be, or are you interested in losing the weight and getting to your healthy weight? And most of them will say, sure, I am. A lot of people don't bring it up to me because they just feel like it's a struggle they've been through for a long period of time. What I tell them is that it's not their fault. There's lots of factors involved here. Certainly genetics and hereditary factors play a big role. And if they look at their family, they'll see that there are more than one person who carries around a lot of weight. Also, there are biochemical issues that occur. You know, we think that there are certain chemistries in certain individuals that drive them to eat certain foods in certain quantities at certain times. We also know that genetically as humans, we're made to build fat. Our ancestors would go out and hunt for food and maybe not kill an animal or catch their food, or they had to pick their food or look for certain vegetation to eat, and it would take them weeks to get enough food to really satisfy them. So when they did eat, they would gorge themselves, build as much fat as possible, and so our ancestors have passed those genetics on to us that really make us easy fat creators and difficult fat burners. Now in our society with food on every street corner, it just makes it very difficult. So I let the patient know that, look, it's not all your fault. Sure, we all have some behavior issues. We need to work on those, and we're going to do that. But with that in mind, what we want to do is partner up and make a serious commitment to getting yourself healthy. It's not about how you look. It's not about your clothes fitting, although those are really important things to each of us. It's really about the optimal health, getting your weight down so that you're at a healthy weight. And I let them know that they're not alone, that we're here to help them. There's lots of different ways we can work with them, whether it's herbal therapies or prescription medication, certain food plans, dietary plans, bringing in a nutritionist, bringing in a dietitian, bringing in a physical activity coach. Any of those things will help. And a lot of patients say, well, you know, that's a lot of expense and my insurance doesn't cover that. So we try to formulate and set up a plan for them that works for them. And we start out slow. Sometimes it's just a matter of discussing the things like, look, you need to eat more fruits and vegetables. You need to stay away from what I call the white foods, which is bread, potatoes, pastas, and rice. Limit the quantities on those. You need to eat more lean meats like chicken, fish, and turkey. Make sure they're baked, grilled, or broiled. Stay away from fried foods. Also, stay away from the high concentrated sweets and snacks. That doesn't mean you can't ever have those things, but it certainly means you can't have them on a regular basis or on a daily basis. So I let my patients know that these are things that they need to make adjustments in their diet. As far as dairy products, you know, you can get good protein from dairy products, but you want to stay away from the high fat products like ice cream, cheese, and whole fat milks. Go to more like skim milks or 0.5%, or in the ice cream area you want to go with frozen yogurts or sherbets. So those are some simple tips that I give my patients right here in the exam room and say, look, try those for a few weeks and see if you can knock a few pounds down. Then we talk about some light exercise, such as starting a walking program. But the most important thing is that we engage doctor and patient, and that we let you understand as my patient that I'm here on your side for health. It's not just about writing a prescription for a blood pressure medicine or giving you a medication to lower your cholesterol. It's really about working to get to your optimal health through lifestyle changes. Certainly I have a lot of patients that we prescribe those medications for, but given my choice, I would rather take a much more healthy and natural way to get you to your lean body weight. And then that would certainly correct a lot of the medical issues that you may have from being overweight. So it's important that we get on the right track together. If you have a physician that you can talk to about that, then I would encourage you to get with them. If not, contact us here at Fat Doctor TV and we'll be glad to talk to you, or maybe we'll be able to hook you up with a physician in your area that might be able to work closely with you. I'm a member of several societies and certainly know a lot of physicians and have access to a lot of physicians around the country that might be willing to sit down with you and work out a program or plan for you to help you get to that lean body weight. And certainly people talk about the cost of this now. Insurance doesn't cover obesity treatment or weight management, and that's true in most cases. But if you think about the true cost of taking blood pressure medication or cholesterol medication, or the cost of bypass surgery, or the cost of just not living the extra 8, 10, 14 years that you might not if you're carrying around significant amounts of weight. I think it's all relative. You know, people say all the time, well, how much does that cost? And I said, well, compared to what? Dying early? I mean, that's extreme cost there, is to leave early and check out, especially if you've got family, kids, grandkids, and people you want to be around. So get with a physician. If you don't have that, certainly send us an email. My coaches, Raquel and Caitlin, will be more than happy to work with you on a regular basis, trading emails back and forth, and maybe an occasional phone call, some teleconferences that we're going to work out so people can connect. But our goal here at Fat Doctor TV is to give you some information, certainly to motivate you, and then to celebrate. Today, rather than doing some rah-rah, I thought we'd just sit down and have that conversation that I have with my patients in the exam room when I confront them about getting healthier, losing the weight, or when they ask me that question, Doc, how do I lose the weight? So hopefully we've been helpful today. We're going to get into some real strong details on specific programs as we move through the episodes of Fat Doctor TV. So join us again, and until next time, I would like to say I hope I see less of you when we get back together. So take care. Again, this is Dr. Greg Oliver at Fat Doctor TV. You have a wonderful day. Bye now.